have two great guests who I have been talking with since the first Trump administration. And we're here now to talk about, of course, what's playing out today. I wanted to start with Gretchen and to help lay the scene. I just mentioned the first Trump administration. We had spoken a lot at that time. Maybe you remember this was 4 to 8 years ago. We had the, it was Earth Day that first time, and the EPA administrator, Scott Pruitt, had taken down a lot of climate stuff from the EPA website. It was a shock. And then we had the Rose Garden announcement, and they announced they were going to pull out of Paris, and everyone was like, we are having crazy attacks on science. And now we have today, and it feels like a different place. So can you help paint the scene of the difference between the first administration and what we're seeing today?
Sure. Well, thanks so much, Zahra, and thank you for this. It is really, we're seeing a huge escalation of what's happening now compared to what happened in the first Trump administration. My role at the Union of Concerned Scientists has been to track attacks on science for the past previous decade. I had worked on that. Then I went into government for the past 4 years, and I'm returning now as the president. And we're really seeing quite an escalation, especially when it comes to climate. In the first Trump administration, we tracked more than 200 what we call the attacks on science. So times that scientists were silenced, or a report was suppressed, or otherwise science was sidelined in a federal process. But right now, we're seeing already far more of those attacks on science, and we are only 6 months into this. And a point that I would make on this element in particular, and as it relates to climate, is that we're really looking at a full erasure of federal climate activities across the board. We're seeing attacks on the research and development activities that fund our preparedness and understanding of climate science and what we do about it. We're looking at destruction of a lot of the programs and policies that help us reduce greenhouse gas emissions, that help us deal with climate-related disasters after they happen, and to build that climate resilience that we know is needed across the country. So we're really seeing lots of erasure of climate activities. And this is different than the first Trump administration, because when I came in to the White House under the Biden administration, there, of course, had been lessening and reduction of climate-related work under the first Trump administration. But when I got there and got to look across the government and see what can we do on climate from different agencies, from the White House level, the bones were still there. You could still find people and programs and things that were focused on climate and clean energy. They had perhaps been less active or done less in the first Trump administration, but the programs and the policies and the infrastructure in the government were still largely intact. And that's really the difference in what we're seeing now, in that we're seeing destruction of entire programs like the U.S. Global Change Research Program, just elimination of a lot of the climate data and resources that existed across government, like climate.gov, for example, has come down. And importantly, and perhaps most crucially, the people that are there that are now being forced out or encouraged to leave. And that's a lot of that institutional knowledge. It's a lot of what we need at the federal level to do all the critical climate-related work that we know is needed.
That was a perfect pivot to Paul, who is, our guy from inside the government. And, he has been at the CDC's Climate and Health Program since before the first Trump administration. It came on during the Obama administration. And as we've been talking, it's clear that this year, for him and his program has been unlike any other. So, we just heard what it's been like for Gretchen, who's been tracking it from the outside. But let's hear from the inside, what's really been happening for you since January 20th, Inauguration Day.
Yeah, and I'll have to start with a little bit of an update. When we were planning this session, I was the former chief of the Climate and Health Program. I'd been fired. Our whole program was gone. We have since been brought back. I'll get into that. It's kind of all over the place. A bunch more people were just fired overnight last night, about 10,000 more people from Health and Human Services. we're still there. But that's just to say, before I go into what a complete disaster it is to work on climate change in the federal government, I have to give the disclaimer that I am here using my own annual leave, and I'm not representing the Centers for Disease Control and Prevention. So got that check mark out of the way. It's been a lot. So it was immediate. The day after Inauguration Day, we were put on a complete hiring freeze, a complete communications freeze. We couldn't even talk to the health departments that we work with. You know, if anybody in this room came to me looking for advice, we weren't allowed to respond to that. So all of our work came to a complete halt. And that's a lot of really important work. What we do is we look at the human health impacts of climate change. And that's something that there's really not a lot of resources for. We were the only federal program that was specifically doing adaptation for human health. So for example, when there's heat waves, like what's happening right now in Seattle, it's gonna be 90 degrees, we would help local health departments and state health departments to do things like set up cooling centers or have communication messaging about, you know, check in on your elderly neighbors, stay hydrated. The same for disasters like flooding, wildfires. We really focused on the human health impacts. So that all kind of came to a stop. It was a really bad environment. People from DOGE were in our building. It was kind of implied that AI was looking at who to fire. Our websites were scrubbed. Any mention of climate justice, environmental justice. We had some info on climate change impacts on the health of LGBTQ communities, all of that deleted. There was even a thing called the Social Vulnerability Index, which we had put climate and weather info into, and it helps local decision makers to look at neighborhoods in their city and look at who is most impacted, like where should we be focusing the resources. That was taken down and only put back up by court order. So it was a lot. And then on April Fool's Day, I wish I was kidding, but at 5 a.m., about 2,400 CDC staff received an email that we were going to be fired. We were immediately put on administrative leave. It didn't come from CDC. CDC didn't even know it was coming. There was no communication. There was no rhyme or reason to who was going to be fired. In fact, there's not even a CDC director or an acting CDC director, so we don't know where all that came from. So we were put on admin leave, and court cases have delayed that. And then about a month ago, about 400 of those 2,400 people that had been fired we got another surprise email that we were being brought back. About half of HR was fired, though, so the process of coming back has been really complicated. But so we're there. Some staff has left. As you can imagine, when you get fired, you start looking for other jobs immediately. So our capacity has been cut, and we're still on the hiring freeze. We're still on the spending freeze. If my computer monitor breaks, we can't buy a new one. Like it's just completely stopped. So we're there, and we're happy to be there, and we're doing the best that we can to support health departments and other partners right now. But yeah, it's tough, and we're just waiting to see what happens next because we have funding through October 1st.
Yeah.
And then nobody knows what happens.
Okay, before we get to the next question, I am going to take this time to do a quick poll. So I think you guys have been doing this before. This is interactive, so please participate if you can. I think they're going to toss the question up. But where are the most promising job opportunities for former federal workers? Is it the private sector, state and local governments, nonprofits or NGOs, or academia? So please, if you can, put in what you think, and then Gretchen is going to provide a little bit of live fact-checking for us on what we're actually seeing play out. And this very much ties to what Paul was saying, where we're having people who were laid off, now they're looking for a job. Sometimes they're being asked back and they've already found a job, sometimes they haven't. So it's a really confusing situation out there.
Yeah, it's first I'd say please join me in hiring former federal employees wherever you can, because there's a lot of incredible talent out there that now needs positions. And the point I just would make on this, just having seen it from the inside, so I did the first 2 years of the Biden administration in the White House, and after that, because of the success of the Inflation Reduction Act and the other federal legislation, I got convinced to stay in government because it was just such an opportunity opportunity to make progress on climate. So I went to the Department of Transportation as the Climate Change Research and Technology Director there. And I was part of a wave of people that were motivated, that came from the private sector, that came from outside government, that hadn't been feds for years and years, but got convinced to come because of the incredible opportunities that existed to make progress on climate. And so that was this really great moment where we had the ability to do a lot of work because you got the institutional knowledge of people like Paul that had been there a long time and knew how to operate in government contexts, combined with new enthusiasm and expertise of people from the outside. So we were able to do a lot in the last few years, but unfortunately now with the new situation, a lot of those people that were game changers in the last 2 years in government have now since left because of the outlook here. And so I think there is a lot we can do from the outside, which we'll get to, but it is an unfortunate situation for all the potential that there was at the federal level.
Thanks. I do want to go back to you, Paul, and kind of picking up that thread where you're saying you are back. But you got this notice, and it's not like a snap of the fingers. You can go back and resume activities as if nothing had changed. First of all, you hadn't even been doing as much when you left, but you mentioned some of the hiccups of some people have gotten new jobs. So can you talk a little bit more? I mean, you mentioned to me a situation that happened with your badge, maybe telling that and just, what it's been like to actually try and get the work done even though you're back.
Yeah, and I can talk about that from the CDC perspective, but it also applies to my colleagues at EPA, at National Weather Service. They're all going through something similar. But as you can imagine, when you fire 2,400 people and then try to bring a few hundred of them back, like you said, it's not a snap of the finger. So people had turned in laptops and badges and all of that. And as I mentioned, human resources was greatly reduced as well. So we had circumstances where, like, for example, when I went in the first time when I was supposed to come back, my badge didn't work. I couldn't get on campus. And I don't blame HR. They didn't have the capacity to do that, but it's just been a really difficult transition to get things back up and running. And that's why I say we're not really doing the work yet. We're trying our best, but with those restrictions and with just the logistical hiccups that come along with everything that's going on, and then kind of the specter looming over us that you could just be fired again, it's been kind of difficult to make that transition back. But I think we do it because we're passionate. I mean, I've worked on the health impacts of climate change for 16 years. I work with an incredible team of epidemiologists. We have an economist. We have evaluators. These are people who are there. They didn't go into government work for a paycheck. They went in because they wanted to help people. So that's why we're back, and that's why we're trying to do the best that we can do right now.
So earlier, Gretchen, you had mentioned some of the lawsuits, and you had also mentioned some of the lawsuits because they have impacted some of the federal employees and whether they actually can be laid off or not. And I wanted to really touch on this and sit with it a little bit because as the Trump administration has been making all of these moves, we've seen state attorney generals, we've seen universities, we've seen NGOs like the Union of Concerned Scientists sue and to legally challenge these steps. And so can you talk a little bit about that as a strategy, how effective it's been, and kind of how that's playing out?
We're seeing the courts as being one of the few effective backstops on what this administration is doing. Because of the scale and the severity of what's happening so quickly, it's been hard to use some of the other tools in the toolbox that we would normally use to advocate and to try to challenge what's happening. So we've been seeing the lawsuits be more effective. We, the Union of Concerned Scientists, has sued DOJ and some of the efforts at the dismantling of agencies, and we've also sued over some of the removal of data and web pages on climate and environmental justice that has been happening across the government as well. One complicating factor, of course, is the most recent, or one of the more recent Supreme Court decisions that did say the administration can move forward with a lot of the mass firings. And that has been one thing that the lawsuits have up until now been able to keep at bay, but you heard policy, I guess they're already getting busy on that overnight, firing many more people. So we'll see how effective that strategy is moving forward in that new context. But I think it's an important avenue to try to push back. And that recent decision did say you could challenge individual examples of firings and cases. So hopefully that can continue to be an effective strategy to try to slow some of the actions that we know are illegal and unlawful.
So we did get a question from the audience that I do want to make sure that we have a chance to ask Paul, which is, Paul, why was your team hired back? Do you know? And what is the goal for your team now?
Yeah, I wish I knew. We have no clue. The email didn't come from CDC. As I said, it was only about 400 people that were brought back, which included the climate program, at least what was left of us, the people who hadn't found new jobs yet. The asthma program, lead poisoning prevention, like a few other really critical health things were brought back. Again, what exactly does brought back mean? Where we only have funding till October 1st and we have all of those constraints. But we don't know, and that's part of what kind of adds to a really bad office environment, as you can imagine, because a lot of our colleagues just got fired yesterday. At CDC, there's still another Supreme Court case. It's hard to keep track of all of them, but for CDC, there is a case brought forth by about a dozen state attorneys general that is preventing the firing from going forward right now at CDC. So most CDC staff that have been fired are still on admin leave if they weren't brought back. But yeah, we don't have any answers. We don't know. There doesn't seem to be a rhyme or reason to it. There was even the Secretary of Health and Human Services had said environmental health is critical. Like, we need to focus on that. We're talking about toxins in the environment. And then all of the people that worked on environmental health were fired. So it really doesn't make sense. And it makes it really tough to keep doing it. I've had people come into my office crying. It's just, how do you deal with that and try to focus as much as you can on helping communities?
So one of the things I wanted to ask, and actually we have another audience question on this same topic, is what can people do about this? So, we have just seen members of Congress say pass the reconciliation bill and the big beautiful bill, and it's kind of clawing things back, and maybe you might think, oh, I should call my member of Congress, and is that actually doing anything? So can you both kind of give some tangible examples of what you think could be helpful in this moment, whether it's specifically helping federal workers or preserving data or just continuing work in this space? And let's start with you, Gretchen.
There is a lot we can do. First, do not give up. Do not be resigned to the situation. One important thing is to tell the story of the impacts of what's happening. That's, of course, what Zahra and many at Bloomberg are doing now. But I think one challenge that we're having is that this looks like esoteric or DC-centered policy wonkery that does not always convey what the real impacts of a lot of these moves are on people, on communities across the country. So the more we can tell those stories, really translate what some of these actions at the federal level mean for real people, the better off we are. So we're doing a lot of that work, and it would be great if we could all work together on that part. And the other really critical element is to work with Congress, to insist that your members of Congress take action on this. There are co-equal branches of government that can be doing more in this moment, and they need to see what can happen now, and we need to push back everywhere we can, in the courts, in the halls of Congress, and in the public narrative.
Yeah, and I would just add, first, totally agree with that, is that we have a lot of the solutions. So for anyone who was here yesterday, we talked about how we have the solutions for greenhouse gas emissions. How do we reduce those? Changing the energy systems. We have that for adaptation on health. I mean, we've been working on this for 16 years. So we have resources, data, frameworks. We know how to work with health departments to do this. So that being lost for a while, kind of back, kind of not back, and then could be lost again, I think that's something that there should be a focus on, that the tools are there. It's just the capacity to implement them at the federal government has really been cut dramatically, and we're not sure if it will continue.